know exactly what it is? Well, we get to find out in a few minutes. I'm not alone. Thankfully, I call him my father in the industry. He's no other person than Dr. Hyacinth Emele, DMP. Omo, this your new title, it's carrying a lot of weight. Good morning to you, Dr. Hyacinth.
Good morning, Mary. Good
DMP,
morning.
What exactly is DMP, please?
Yes, is a new cap, a new feather in my cap. Just on the 26th of November, Nigeria Medical Association, Imo State, crowned me with the Distinguished Medical Practitioner.
Wow.
That is the highest award you can ever get as a doctor in this state.
Wow.
And I want to thank God for that. So I am now a DMP. So
DMP.
when you write my name, you write DMP.
That is
Dr.
good.
Hyacinth Emele, DMP.
DMP.
So it's a thing of glory to God, and I want to thank NMA for that honor.
Yes. Oh, and I also join you to thank them as well. You know, it's one thing for you to be in service for so many years, and it's another thing for you to get recognized. So I would want to commend you, Dr. Hyacinth. You are a father to me, whether we like it or not. We've been in this health, thing for a long time. Tell them, let them know.
It's been a long time.
It's over 9 years, right?
It's over 9 years.
Over 9 years. So
and,
I'd like,
and we will keep doing it together.
Thank you.
As far as there's life.
Thank you so much, Dr. Hyacinth Emele, DMP, specialist, family physician from the Department of Health Sciences, FUTO, also a former chairman of NMA Imo State branch. Thank you for joining us this morning, Dr.
Thank you, Mary, the Slim
Emele.
Diva. Thank you, Imo Lights.
Okay.
It's going to be a wonderful time on radio, so listen to us very attentively.
Thank you. All right, so male andropause, is this a myth or reality? We shall find out if andropause is the same as male menopause. What's the difference between menopause and andropause? I hear most men say, oh, I'm a man, even at age 80, well, even if I get to 80, 85, I can still impregnate a lady. That's how active I am. But for such men that make such statements, what happens when andropause sets in? That's a very big question we'll be getting answers to. So over to you, Dr. Emele. Help us understand the term andropause.
Yeah, thank you very much. I want to say is a topic that will incite people, and particularly males. The male folk will be incited by this topic because so many people may not have understood what is happening to them. Maybe when we make those explanations, they will get to understand that majority of the things that happens in the life of a man or a woman are destined by God.
Okay.
Now, let's start by saying that life is a series of natural transitions. That we all know that life starts from conception, where you now have the fetal life. We're in the womb of mothers, surviving for 9 whole months. 40 weeks we're there, surviving, and then we are born. And when we're born, we'll go into adolescence. From adolescence, we'll go to adulthood. Then from adulthood, the women will go into menopause.
Okay.
And at that time, the woman is going into menopause. Some men are going to andropause, which we are going to explain today. Then finally, we have the senescence. The senescence is a process of deterioration and death. That is when the organs begin to shut down. Then you see organ failure.
Okay.
And then the person dies naturally. That's why when you see people at the age of 100 and something, they sleep. And they don't wake up because the senescence has set in and the organs are shutting down one after the other. Now, in females, we have the very popular menopause.
Yeah.
Menopause, just like the name implies, is just that the menses of a woman stops. That menses that she has monthly, periodically, stops. That's the menopause. Then the pause means stop. The menses stops. That's menopause.
Okay.
So that is menopause for you. And in women, when menopause sets in, the fertility dwindles out to a point where the woman cannot be able to conceive again and to have babies. We're going to take time to explain the difference between the menopause and then the andropause, which we have in men.
Okay.
Now, what is andropause? I want to say that andropause refers to a clinical syndrome. Imagine when you say a syndrome, syndrome means a constellation of a few problems, few symptoms and signs that come together to form the syndrome. So it's not just an entity, it's a syndrome associated with advancing age. That's one.
Okay.
It's associated with an advancing age and is characterized by a gradual decrease in androgens. Androgens in the body, primarily what we call the testosterone. Now, the androgens, they are hormones. And going back to the basics, biology, we might also want to understand what the hormones are. The hormones, like we're told in our biology classes, they are just messengers in the body. They are produced by the ductless glands. When we advance, they tell us they are the endocrine glands. Those endocrine glands produce these hormones, and they regulate body functions. An example is the thyroid. The thyroid organ in the neck, which
region,
produces the thyroxine. Another one is the adrenaline that is produced by adrenal glands. These are all hormones. But what happens is that because they are produced by the ductless glands, they are moved straight into the bloodstream. And they begin to give instructions for the body to function.
Okay.
So you talk about body growth. You have the growth hormone and all that. You have metabolism, like the thyroxine. You have mood. And then reproductive process, like the testosterone we're going to talk about today. It is involved in the reproductive process of a man. So now, when a man is growing older, now this testosterone will now begin to depreciate, to now begin to go down. And when it goes down to a particular point, then the man begins to now get some signs and symptoms of this andropause we're talking about.
Okay.
Now, but like in menopause, the woman when is about 40, 45 to 50, the menopause sets in and the menses ceases. And when that menses ceases, that means that woman can no longer, procreate.
Okay.
The woman cannot get pregnant any longer. But in contrast to this, andropause is something that sets in over a long time. So in men, when they get up to 40 years, now because the testosterone has started going down, they now begin to show signs and symptoms of the andropause, which we're going to explain. So it continues till the man is 80, 90, 100.
From 40 up
From
until
40
50?
years to 50 to
really?
60, and then to the time the man will die.
Okay.
So it's going. The andropause is one that takes a whole lot of time, unlike the menopause that comes in and sets in immediately, and when it sets in, that woman's fertility is at the 0 level.
Yes.
But a man still, can able to impregnate a woman even when the andropause has set in.
Oh, okay. Wow, this is well explained. So, from what you have said, menopause happens abruptly.
Yes, it does.
Andropause takes a while,
Yes.
before it
Takes
sets
some time.
in.
Yeah.
Okay, so while I was doing this research, I saw something and I got curious. It says that not all men will experience andropause. Is that true?
Now, the point is that andropause has levels. So the way it will occur in one man is not going to be exactly the same it will occur in the other. So because it is at levels, some people might be lucky that their own affectation might just be mild, that you may even think that they have not had any trouble at all.
Okay.
And that means that the level of decrease of their testosterone is low. So if your own decrease, if the testosterone in your system is decreasing at a very low rate, that means you will now begin to get these symptoms and signs gradually over a number of years. But for men whose testosterone has gone down very drastically, probably because of lifestyle, probably because of surgeries, probably because of maybe affectation of the testes that produces this testosterone, those people will now see signs and symptoms of andropause very quickly and at a higher level. So all men experiences andropause, but at different levels.
At different levels. Okay. So now you mentioned from 40. Is there a specific age bracket? I know why I'm asking this. That is mostly affected by andropause.
Yes. Now, when you talk about specificity in age, you now begin to think about the elderly. And the elderly, in a climb, the elderly starts from about 60 to 65.
Very true.
Yes. Now, are those elderly people at 60, 65 years? Definitely, there must be some element of andropause. But for some people at 40, 50, they escape these symptoms.
Okay.
Just like I told you, because maybe the level of affectation of their level of testosterone is at a very low, it decreases at a very low rate. But at 60 years, definitely, there must be some level of affectation of your level of testosterone. And at that point, the person begins to show signs and symptoms of andropause.
Okay, now I know that people are listening. You want to be a part of our conversation. We can open up the phone lines right now for you to call in and ask all the questions that you want. I know that sometime last 2 weeks I promised you that we'll do justice to this topic when it was mentioned. Someone, I think it was a nurse who mentioned the word andropause, and I got curious. Since that time till now, I have not rested. So here we are. 0911 20,022, 0911 20,022, or you call 0707 454 1014, 0707 454 1014. We are also live on Facebook at Echo FM, ECHO-FM. Go live right now on Facebook. You see myself, you see Dr. MLA. Drop your comments and it will be read out as fast as we can. Hello, good morning to you.
Good morning to you. How are you?
Very well. What's your name?
My name is Jessica Steven and I'm calling from Feedback and
Ah, your line is really breaking, but try as much as you can to change your position and then go ahead.
Okay, are you hearing me now?
Yes, go ahead, please.
So, I said I'm calling from Feedback and
Go ahead.
So, greet the doctor for me.
Thank you.
I can hear you.
Yes.
Thank you and good morning.
Good morning. Now I get to know why a particular service senator got married and still has children up to this age. Marries a number of wives and not to 90 people coming well. So I guess better if you speak with what you're giving me now, and I'm happy for that. Please greet the doctor for me especially.
Ah, thank you.
Thank you very much.
It seems more like you're mixing things up, where he's referring to a particular senator who, even at the age he is right now,
can still procreate.
So I think he's mixing.
He has just gotten 1 point.
Okay, 1 point.
So you need to listen more now.
Thank you. So you didn't really get the basics,
Yeah.
but keep listening.
Yeah,
All right, we lost this call. Keep your calls coming in. 0911 20,022, 0707 454 1014. Are you aware, as it is in women, you hear menopause. Men also undergo andropause. Did you know this? Well, are you curious? Call in now. Hello.
Cindy, very good morning to you.
Good morning to you. What is your name, please?
My name is Jack. I'm calling from Owerri. Good morning to your guest.
Good morning, my dear brother Jack.
All right. It's a very quick one. So, Cindy,
Yeah.
and Doc, how safe, credible, and if you like, effective is what they call testosterone replacement therapy or medication, drugs, something like that. Thank you very much.
Okay. Dr. Emele, did you get that?
Yes, I did.
Okay.
I did. Jack, thank you for that question. We will be getting to that point where we'll talk about maybe the how to
Management.
the case of andropause. Now, testosterone replacement therapy is a normal thing to do, particularly if you have a patient that is showing adverse, symptoms and signs, particularly for those who are young, relatively young. Maybe when you have somebody who's 50, 60, 65 to 70 years and is showing extreme symptoms of andropause, you can give testosterone replacement therapy. But it must be given under the supervision of a very experienced practitioner, a doctor.
Okay.
So sometimes, because the idea is that testosterone has a lot of advantages, but we also have discovered that if you give it in a wrong way, or maybe more than expected, it can also cause some anomalies in the system. Particularly, it can cause cancers of the prostate.
Really?
It's been indicted in causing cancers of the prostate. So that's why when we give the replacement therapy, we're very careful, and it is given only by experienced
medical practitioners. Okay, now you heard that, Jack. It is possible, but make sure if it is to be done, it is done by someone who knows the job. Okay, thank you very much. Keep your calls coming in. Let's see what this person has to say. Good morning to you.
Yeah, good morning, the presenter and doctor in the studio.
Good morning.
Good morning.
What's your name?
Yeah, it's MC Moonlight from Obaoma.
Okay, MC Moonlight. But this is we are in the day, so I'm wondering, are you going to give us sunlight?
Don't worry, I will even make a comedy through this very topic. Don't worry.
Okay, please go ahead.
So, I heard about andropause, right?
Yes.
Yeah. I've seen a young man, below 40 years, who encountered such a life. And both of them, I mean, the young man and the wife went to the hospital, and they observed nothing. They said they are okay. That is, the woman conceived and the man is okay. So my question is, as a man that developed the andropause, maybe he gave birth to a child, and when the child grows up, could that affect the testes or the productive organ of the son? Because I believe that man was the man in question was below 40. I mean, the man married the lady that went to the hospital and they discovered nothing. So does it mean that anthropoid might be cause of the infertility or the poor reproduction?
Okay. Thank you so much for your question. Dr. Emele, did you get what he said?
Yes. Now, your question, one need to take good history of that patient.
Okay.
You need to understand exactly what the patient is undergoing, because when we're going to talk about the symptoms and signs of andropause. But for some people who may not be well educated about it, they may not really understand the difference between andropause and some other medical issues. Like erectile dysfunction is another thing that you may see in andropause, but sometimes it can come up on its own. So for somebody who probably went to the hospital, has issues with conception, maybe the man is unable to impregnate the wife, it might just be as a result of other issues, like maybe somebody who has had infection and then the sperm cells has been eaten up by bacteria, and then the person is unable to produce spermatozoas. So when that happens, the person may not be able to impregnate the wife.
Okay.
That is not andropause. Andropause, most likely, if you get that particular problem from a man who is 60, 65, 70, you can begin to look at the side of andropoid. But for a man who is 40 years, who comes up and probably has, the testicles are now smaller than normal, and then he's unable to produce enough of spermatozoa and all that, you need to find out why that has happened on that man that is 30, 40, 50 years. So if you now do the investigations and there's nothing to be found, because andropause can lead to a kind of degeneration of the testicles, and that's why most of the time you see these people who are elderly, they can no longer produce enough of testosterone because their scrotum has gone in. Even their manhood has also gone in. These are signs of andropause. But for a young man who is 30, 40 years, whose scrotum suddenly begins to go in, you need to investigate what is happening to that person. So for this particular couple you're talking about, the doctor needs to investigate further to know exactly what the problem is. Is that man producing spermatozoa? If he's not producing, what's the problem? What happened to him? Has he had, cases of STIs, sexually transmitted infections, like gonorrhea? In those days, when there were no good antibiotics, most people suffered gonorrhea, and the gonorrhea organism ate up all the cells that produce spermatozoa. And today, most of them can no longer procreate. If you take their history, you discover that they have had the gonorrhea, which they treated locally. And because they treated it locally, the microorganism now formed a ball in their testicles and ate up all the sperm cells. Okay. So for such persons, you need to find out whether the person is having that problem as a result of maybe past infection, or the person is having it because he's aging fast. Because some people age faster than normal. Because some of those people who age faster than normal will now begin to show signs of andropoid earlier than some of their mates.
Okay. All right. Well explained, MC Moonlight. I hope that answers your question. Let's take 2 more calls and then we go over to the conversation. Good morning to you.
Hello?
Yes, hi. Good morning. What's your name, please?
Mama from away.
Okay. go ahead.
All right. Please, I would like you to tell me the personal number of Dr. Nkiru Chinedano that came in last week.
Okay. Please send me a message on our WhatsApp, okay? 0707 491 3438, okay?
Okay,
yeah.
Call the number again.
All right, keep listening. I'll repeat the number. Our WhatsApp number 0707 491 3438. Drop me a message and you get the response you need, okay? Thank you very much. All right, more of your calls. We have messages on Facebook. This person, Maureen Ogadi, says, good morning, Doc and the Slim Diva. God bless you. God bless you too, Maureen.
God bless you too, my dear.
This is Onwogaku David. He says, welcome to our doctor. Okay, Dr. MLS, some people are welcoming
Thank you very much.
Thank you. Hakot Odu says, good morning, Doc and Mary the Slim Diva. Does andropause occur in every man as it is in women? I know you have responded to that particular question, but maybe you can just respond again.
Yes, we have said it before that it's an aging process. As soon as you're aging, andropause will set in, but the level of affectation of andropause in one person may not be the same with the other. That's why you see some men at 80, 90 years, they are still sexually active. But some of them who are at 80, 90 cannot even remember where their wives are again over the years. So it's because the level of andropause is different from one person to the other.
Thank you. Joy Phillips says, good morning, Mary and our own doctor. Thank you for this wonderful topic. May God continue to bless you all.
God
Amen. Okay, so Dr. Emele, I would want us to go into the symptoms. I know you already mentioned erectile dysfunction.
Yes.
Are there other symptoms that we should know about?
Yes, there are so many. I'm sure as listeners, they are waiting to get to know the symptoms of this particular syndrome.
Yes.
Now, for a man who is growing older, there are things that happen to a man, and you see, most of them are natural, but some people do not understand they are natural. When a man is growing older and you're 40 years and 50, and then you have reduced energy, the energy you used to do certain things has reduced, and you're beginning to complain. Why are you complaining? The energy must reduce because you are aging. And one of the signs and symptoms of andropause is energy reduction. So you see a man who, he can carry 2 blocks at the same time, but he can no longer carry 1. So that means that you're aging. So you must also watch it. Now, for a man who is also growing older, you see decreased sense of well-being. You look so active and agile before now, when you were, at your 30s, at your 20s. But suddenly, you now begin to find yourself not being, healthy enough. In the morning, you wake up, you cannot even come up from your bed very, very agile like you used to do before. This is because you are beginning to face the problem of andropause. Now, there's also decreased libido. I have mentioned erectile dysfunction. Libido decreases in a man who is 40, 50, 60, and that's why sometimes you see people coming to the clinic to complain to us. Sir, I used to have with my wife three rounds of sex, and now I cannot go one. Yes, normally you can't, because at this age you are going down. Your testosterone level is going down. Other hormones are going down, those that makes you, agile and walk. So your adrenaline level they are going down. So because you're aging, you're 45, you're 50, you don't expect to have that same sexual strength you have when you were young. So decrease in sexual libido and erectile dysfunction, which means you can no longer sustain good erections that will help you to do the work you used to do before. So when that happens, sometimes it's as a result of andropause. Now, you discover that even when you ejaculate as a man, when you were young, you ejaculate and you see ejaculation, profuse ejaculation with so much quantity of semen. But at a point, you now begin to see that the ejaculation is now, scanty ejaculation. Sometimes you don't even see any ejaculation. And I have also seen cases where, couples have come to my clinic to complain. The woman was complaining that the man doesn't ejaculate. And maybe he's ejaculating elsewhere. I want to tell you that it's not that the man is ejaculating elsewhere, but because he's aging, the level of the quantum of ejaculates begins to reduce.
Is that what people say? What they mean when they say I was trying to ejaculate and it went back?
Yeah, so that is one of the signs. Because sometimes you don't even ejaculate at all. During ejaculation, you discover that nothing comes out.
Okay.
And when that happens, that might be a reason for you to suspect that andropause has set in. Then the body mass begins to become lean. You see your muscles going down. The muscles are going down, but the fats are coming up. That's why you see obesity in most elderly people. When they are getting obese, look at them. What you are seeing is body mass that's made up of fats. But the muscles themselves have gone down drastically. And that's why if you check the powers in their arm, their extremities, their hands and legs, the power reduces. So this is also sign of somebody going into andropause.
Okay.
Now, loss of hairs on the body, and even baldness. You discover that somebody becomes bald, and then the hairs on the body, those of them who are very hairy, the hairs begin to fall off over time, and these are signs of andropause. Now, sweating profusely, and then not being able to sleep at night, anxiety, these are things, irritable mood, because as we're talking about the physical signs of andropause, it also has a mental side.
Really? Okay.
So you now get irritable mood. They have mood changes. They can get angry easily. They don't, those things that they love earlier in their lives, they begin to hate them. So when this happens, it's also important to begin to suspect that andropause is certain. Depression, low self-esteem. You see an elderly person who can no longer, he used to be, very agile, very, very happy with people and all that, but suddenly, you now see him in a different mood. He gets depressed easily. He gets angry very easily. These are some of the signs of andropause. Now, less interest and desire for sex. We have said it. That's low libido, poor erection. Now, reduced quality of orgasms and ejaculates. These are all signs and symptoms that you can see when andropause set in a man.
Wow. So is it safe to say, that with all these signs you have reeled out now, when a man gets to that stage, most of the time they tend to want to start to abuse substances? Energy drinks, substances just to keep them afloat because they still want to be as strong as a horse.
Yes. The better thing to do is not to abuse substances. As far as we're now making these things clearly to people, what you should do as a man who is getting elderly is a gift from God. So many people died very young. So if you're getting elderly and these signs and symptoms are setting in, quickly go and see your doctor. Your doctor he will give you, a psychotherapy. He will tell you what to do to be on a safer side. And then if need be, like our brother who asked a question earlier, there may be a kind of replacement of some of those hormones, by the doctor who is an expert on it, so that you will not begin to have some of those things you have lost.
Okay. All right. Back to the phone line, 0911 20022 0707 454 1014. Let's hear what you have to say. Good morning. I was about saying afternoon. Good morning. Okay. Try to redirect your calls to the other number. Good morning to you.
Good morning.
Welcome. What's your name, please?
I'm Mike Onyechefula Odunze from Amafo Imoyo.
Okay, go ahead.
I don't miss this program every day.
Thank
Dr.
you.
Emele, you are welcome.
Thank you, sir.
You are too good. You have said it all, or you have said it all. Some people go to hospital because they don't have to do.
So let me also tell you, I'm from Ngopala. I'm from Ezemba in Ngopala local government. You're my brother.
I'm from Imediwe.
Okay, you're my brother.
You're my brother. I know you.
Village people, you have your meeting
So
later.
I am so happy with this your program. We'll keep it up,
Thank
please.
you. Thank
God
you
bless.
so much. Thank you for the contribution this morning. I appreciate you as always. Good morning to you.
Yeah, good morning.
Good morning. What's your name and location, please?
My name is Ambrose Aloysius. I'm calling from Ihodines.
Go ahead.
Yeah, I want to ask, though I'm a first-time caller, I want to ask the doctor there, does masturbation have anything to do with early kickoff of this andropause?
Okay.
Okay.
That's a good question.
that's
Are you
that's a very
done?
good
Are you
question.
done,
Yes.
Ambrose?
I think let other people ask other people.
All right. Thank you.
Okay, thank you, Aloysius, for your question.
Ambrose.
Ambrose Aloysius, that's what he
Yes,
said.
okay,
Ambrose Aloysius.
okay.
There is a very important question because masturbation is beginning to be a very serious problem in our youths. In our clinics these days, you see a whole lot of them coming to seek for solutions to their masturbation.
Okay.
Now, masturbation has nothing to do with andropause at all. There's no connection between masturbation and andropause. The only thing is that anybody who masturbates, stand the risk of developing erectile dysfunction early in life. Erectile dysfunction is when you can no longer sustain a erection that will be enough for you to have good sexual relationships. So most of the people that masturbate, before they get up to 40, 45, 50, they have lost their strength of having normal erections.
Okay.
The normal erections will escape them. And that's why we advise them early to stop as quickly as possible, because if you don't stop early, definitely you will lose your ability to have erection on its own over time.
Okay, so no link between masturbation and andropause. You heard it this morning. Good morning to you. Hello, good morning. What's your name and location? Quickly.
Okay, my name is Chris Okere. I come from Ngobalo. I just want to greet my brother. I am so happy when I hear my people that go to school and God bless them in their qualifications.
Thank
I am
you.
so happy.
Thank you.
Yeah, my brother.
Thank you.
Magewa.
All right, Chris, anything to add? And he's gone. Okay, thank you so much for your call this morning. Good morning to you.
Morning, how are you?
Very well. What's your name, please?
Read the doctor for me.
He can hear you. Good morning.
Good morning, sir.
The king himself.
Good morning. Go ahead. What's your name and location, please?
The king himself, they tell you.
Okay, go ahead, please.
I want to know whether there is something drinkable, eatable, something that somebody that's having that andropause can take, which will help the person to, go further.
Improve.
Okay.
Okay.
Thank you. So he's asking Dr. MLA
Yeah,
diet
yes.
modifications.
Yes. Now, thank you very much, sir, for that question. Now, you see, some people might think that the only cause of andropause is reduction in the hormone we call testosterone. It's not the only cause. There are other causes, just like we have mentioned now. When you don't have a good lifestyle, a very bad lifestyle will definitely affect you. Now, eating is also a lifestyle that we must improve so as to continue to have a good life, a good quality of life.
Okay.
Because when you are growing old and you can no longer do certain things, the quality of your life, dwindles, and it makes people go into depression and low self-esteem. Now, about eating, when somebody is malnourished or when somebody is not feeding very well, you don't have enough of vitamins, you don't have enough of, the balanced diets, you don't have enough of minerals, it affects the person, and some of them may go into andropause early in life. So, like you have asked, what anybody who is getting older should do is to make sure that you feed with, good quality foods. You don't go for junk. Good quality food will include vegetables, fruits, white meat, less of carbohydrate, more of proteins, and all that.
Yes.
So for an elderly person, you don't need to every day you eat apple, you eat gari, you eat yam, you eat bread, and there is no proteins, no vitamins, no minerals. So when you are eating, in fact, the minerals and vitamins are even more important in a man's sexual life than carbohydrates and then proteins.
Okay.
So when you take a lot of vegetables and fruits, sir, definitely it will improve on your ability to even produce the testosterone we're talking about, because testosterone is also a chemical. And these chemicals, most of them need minerals and vitamins to be built up. So when you take a lot of minerals and vegetables and fruits, they are better off than when you eat a whole lot of apple. You go and buy apple 500 naira and then stay at the place and finish it.
10 wraps.
So that improve in nutrition, improve in your lifestyle will also help you to go away. So those of them who also, like you have talked about, those who abuse substances.
Yes.
Substance abuse will go and deplete the testosterone level. Okay. And when that happens, the person will begin to have problems with, sexual drive, energy to work, and maybe the mood. These things will begin to affect
the mood.
The individual, and then the person may have developed high level of andropause.
Okay, so let's go over to WhatsApp. Good morning, Mary. It is Peter from Douglas. Please, is there anything like sperm cramps I have heard some people say it, and I want to confirm if it is true. Dr. Emele, help us. Anything like sperm cramps, have you heard that before?
No, cramps?
Cramps, normal pain now, I mean. But he's saying this time around sperm, it's linked to the
sperm.
I think
what he's referring to is that, when you are young, and then maybe you have an urge. When you have an urge, oftentimes, the body produces some semen. And some of them are stored in the seminal fluid. And when that happens, and that there was no action taken, the person did not have sex, it was not, the semen was not released, it gives you a little pain. And that pain subsides over time. You see, but one problem that people now have is that they tell you if you don't release that sperm, that it will cause cancer, it will cause this and that.
Yes.
It's not true.
Okay.
That pain is a natural pain because there's fluid in your seminal vesicle. That's the tube that houses the semen. So when those semen have been produced and they are not released, they can give you that kind of pain. That pain stops on its own after some time. So there's nothing like you must release it. If you don't release it, it causes problems for you.
You're even using a better English. They say if you don't discharge it.
Yeah, if you don't, yes. No. Those things are just to deceive those who do not understand the system.
Okay.
And so many people have been deceived in that manner. You see a young person telling a little girl, please, if I don't release this thing now, I will die.
Yes.
And then the person might, out of not being able to control him or herself, agree to that. And at the end, it causes trouble because the little young girl becomes pregnant, and then problem starts. And these may be people who are insecure.
So this is a natural process.
It's a natural process that takes care of itself over time.
Over time. Okay. Good morning, Doc. This is Maduka texting from Prefab. I just want to say thank you to my chairman, Dr. Emele, for the enlightenment. And Maduka is saying hello to you, Dr.
Maduka,
Emele.
I greet you, my brother. Maduka is from my neighborhood.
Okay. Good morning, Doc. What can someone do to fix andropause back? This is from Ike Ibebulam from Umwezala Eziobodo. Did you hear that?
Yes, you can't fix it back completely. But like we have said, if it becomes problematic, you can go to hospital and the doctors can try as much as possible to reduce the symptoms. The symptoms can be reduced, but they cannot be stopped entirely. Because I told you earlier that life is a natural transition. And when you have gotten to that point, you cannot go back.
Okay.
So all you need to do is to expect it and then to manage it. You do not stop it entirely.
Okay. Good morning, the Slim Diva, the doctor in the house. Please, Doc, what do you have to say about herbalists who claim to cure erectile dysfunction and then they give herbal medications? That's what he's asking.
Now, you should know that what I do is orthodox medicine. But we also have the alternative medicine. I'm not an alternative medical practitioner.
Yeah.
So there are people who are practicing alternative medicine, and there are people who also go to them. So I wouldn't be able to say whether they're getting the right thing or the wrong thing. What I would say is only the ones that come to me as an orthodox doctor.
Okay.
So what I do is what I can be able to explain and to tell the people. So what they do, they will be able to come up on air and also explain to the people what they do.
Okay. Okay. And Yunan is saying, Betalicious morning to you, the golden voice. Please, are there fruits which we are not supposed to take? It's a little deviation, Dr. Emele.
No.
Are there fruits which we are not supposed to take
Not
before?
at all.
No, he's asking before bedtime if we want to sleep and get well and healthy. That's what he's asking.
Okay,
Anuforum Yunan.
This question may be one that you can direct to a nutritionist. I am not too sure of any fruit that you cannot. I eat every fruit, and I sleep well with all of them. So, but you can ask a nutritionist to find out whether there's anyone that stops you from sleeping well.
Okay, and the last message on WhatsApp. Good morning. God bless you. I am Damian from Irete. Please, I am 18 years old, and I usually feel very weak. I'm already scared that I might have low testosterone. I have never been with a lady before, and my peers are advising me to do that so that I will not have prostate issues. Hey, although I have cut them off because it is against my rules and regulation, but I need advice. Dr. Emele.
Yes, young man, thank God you were able to ask these questions. What you should do immediately is to find a way to the hospital to see a doctor. See a doctor immediately and tell him some of these your problems. You will be investigated, and then at the end, you will get a solution to whatever the problem is.
Okay, and this one says, if one loses his erection to masturbation, is there any remedy? John from Ebu.
The remedy is for you to stop masturbating now.
Okay.
Stop masturbating now, because majority of them find it difficult to regain it again after they have lost it. I have to tell you from experience, I've been a doctor for close to 30 years. So don't continue the masturbation. Just stop the masturbation now that you still have time, because if you don't, the masturbation will stop your erection.
Okay. Omar Kufidel Isundudi says, good morning to our presenter and the doctor in the studio. Texting from Royce Road, I want to thank you for the lecture. Okay, thank you very much.
Thank you very much too.
No more questions there. So, but I want to find out before we go to debunk some myths, Dr. Emele, if the testosterone level in a man is very low, what other complications can arise?
Yes. Now, when the testosterone is low, that is what we call in medical term hypogonadism. Now, some of these things we have mentioned will now be on a higher scale. What I mean by that is that if you're talking about decreased libido, now the person has decreased libido at a very high scale, that he doesn't have any interest in sexual relationship. Then if the person is also having erectile dysfunction, the erection is so poor that the person may not be able at any point in time to look at the woman. So these are some of the issues, particularly, the testosterone is just for male reproduction. And those things that are around the reproductive process of a man becomes drastically affected. So if it is very low, the person may not be able to have any erection or even libido. And at the end, that person may not even look at a woman and may not marry. Because that's why you see some people up till as we speak, they don't have erection at all.
Yeah.
And some of them have decided to live the celibacy life, and they are not married.
Okay.
But you may not understand. But if you take a critical history of those people, you discover that they have hypogonadism, which is almost zero level of testosterone in their system.
Oh my God. Okay. Yes, treatment options. I know you are going to talk about the management. You talked about hormone replacement therapy. Are there other options available?
Yes, apart from the hormone therapy, the major treatment that we use most of the time is counseling. And then when you counsel a patient, because already you have taken the history, some of them may be abusing drugs, some of them may have had surgeries in their scrotum, some of them may have had orchitis in the past. So sometimes what you now do is to advise the patient on the lifestyle that will help him to be able to run away from some of these symptoms.
Okay.
So if somebody, for example, had orchitis when young, definitely some of the cells that produce some of these hormones and then some of these sperms are affected. So what you now do is to advise the patient on how best to go about it. So because psychotherapy, for me, is a better option of treatment than hormone replacement. Like I've told you before, that if you're unlucky, the hormone replacement, if not done accurately, can lead to cancers, particularly of the prostate. So oftentimes people come in, you look at their history. Are they not feeding well? You tell them what type of food to eat. Are they doing so much strenuous work? You ask them to reduce on their strenuous works. Are they sitting at a time like a man who drive long distances? Do they drive like 24 hours sitting? You tell them to, from time to time they stop to walk around. Do they wear, tight panties that affect the scrotum? You tell them to release the scrotum by wearing boxers instead of panties. Okay. So this psychotherapy is the better way to manage these patients, because by the time you have told them where the problem is coming from and they have stayed from that area, definitely there'll be a lot of improvement. And then if you now see that the symptoms are quite, aggressive, you now resort to hormonal replacement therapy.
Okay. And one question on Facebook, Onyenezi Regina says, good morning, Doc and Mary the Slim Diva. Can andropause cause abnormalities in the formation of the fetus? This is a very important question, Dr. Hyacinth.
Yes. Now, when somebody is getting aged, when the transition has got to the point where the man is aged, like maybe, let's say, an 80-year-old man, 80-year-old man has at that point developed a whole lot of andropause, and then the genes have also been affected. Now, if the genes are affected in terms of wrong replications, that's why you have what we call the trisomy 18. That's the Down syndrome. Down syndrome is mostly got to when a man is quite advanced, and then he is impregnating a young woman. So most of the time, it comes down to Down syndrome.
Okay.
So oftentimes, when you have gotten to this age of 60, 70, 80, there's affectation of the genes that even the spermatozoa themselves, they are no longer as accurately, commissioned by the system as they're supposed to be. And when they are not accurately commissioned, then they may have some problem with replication, and that thing, when you now impregnate a woman, might come up with problems with that baby. The baby may come up with some congenital anomaly, not only Down syndrome.
Yes.
You might also get some of that congenital anomalies in this baby from men who are aged and who have developed andropause.
Andropause.
So definitely andropause may affect the baby during the fetal era.
Okay. Good morning, Dr. ML and the Slim Diva. I am Mrs. Duru Chidima from Spibat. My question is it true that prostate... let's just deviate a little. Is it true that prostate happens to men for lack of sexual intercourse? What advice do you have for couples that stay in different countries? Wahala, Dr. ML. Okay, as fast as you can, please.
Yeah, prostate problems. Research has shown that prostate, particularly the prostate cancers, not the enlargement, because the enlargement is a common thing that you see whenever a man grows up to 40 years. As soon as you're 40 and above, your prostate begins to enlarge. It's a normal thing that happens to every man. But for cancers, it's been found that those who do not, involve themselves in sexual intercourse, like celibates, they have more of prostate cancer than those who are involved in sexual activities. But the problem we now have is that people are claiming that for you not to have prostate cancer, you must have to be sexually active and you must be doing it every now and then. That's what is wrong.
Okay.
The only thing I have to say is that some of us should know that anything that you do in excess is wrong. So when you are already sexually active, all you need to do is that once in a while, you have a wife, once in a while you have sexual intercourse with your wife.
Okay.
It's just once in a while, not for somebody to come and tell you that you have to ejaculate 28 times in a month to be able to run away from prostate cancer. So,
is he a machine?
Even if you're a machine at that age, you are beginning to get some level of andropause. So, and the energy is going down.
Exactly.
The libido is going down. Erectile dysfunction is coming up. So, definitely, you can no longer be carrying out as you were carrying out when you were young. So,
very true.
That's the. I think she has another question.
Yeah. Okay. And no, she was asking for couples in different countries.
No. That one I cannot answer that one, my dear.
He's a counselor that will answer you.
That will answer that one.
Okay. Thank you, Mrs. Duru. So quickly, let's just try to debunk this myth. Andropause doesn't exist. While you do a brief summary of what we've discussed, and then if there are things we have not touched on, please, now you have the floor, Dr. Emele.
Okay, andropause exists. It does exist, generally, because for every man that is born today, in the next 5 years, the person will be 5 years, and the next 10 years, the person will be 10 years. So as you're transiting from, one year to the next, things are beginning to change in your system. And like I said, from that fetal life when you were in the mother's womb, till you get to adulthood, maybe till you get to andropause for men and menopause for women, you still continue to move. But there's adaptations. There's modification. That's why some people are better than others. They modify because they do a whole lot of things. Most of them are very active. They do exercise. Most elderly women, you see them doing exercise. When you go to them, they discover that they're even more active than most young people.
Very true.
Men also who do exercise, who are quite active, you see them, they don't have any problem with their mood. They are sound. With their sexual relationship, they are sound because they are still active, physically. You see, quite unlike those who try to, probably because they have made some money, they want to stay at the place and enjoy life.
Yes.
And then before you know it, trouble starts. So, for all men, all I will have to advise them to do is that you must be able to have your mood in check. You must, because when you suddenly change your mood and then you become aggressive, you become, you now have low self-esteem, you don't even understand what people are saying. Even your wife, when your wife advises, you think she's trying to probably, cajole you. When your doctor talks, you say, no, he's a very young man. He doesn't know anything. So it's important to keep your mood in check so that when these things are coming, you understand them. And then the best thing to do is that once in a while, you visit your doctor.
Okay.
When you visit your doctor, tell him exactly what you have. Tell him the exact problems. Because doctors work with information. If you now don't give that is like, just like when a woman comes to you and asks her, what is the, how many years are you now? You say a woman who is about 60, tell you he's 54, because that's what he has in the public service.
Okay.
No, tell the doctor your age, because he's going to work with that age.
Yes.
So if you don't tell him your real age, he will not understand, because there are peculiar problems at particular times. So when you tell the real age, the doctor will be able to understand, the problems surrounding that age, and then be able to counsel you, and then probably to give you some drugs to take care of that. And it's important for us to feed ourselves well. I know things are difficult. Let's eat good food. Let's eat fruits. Let's eat vegetable. Let's make sure that we're not eating junks. Let's not just leave our house empty bellied. When you go out, you now look for one or two things to take and all that. So men should try to make sure that they are feeding themselves well with good food.
Thank you. And that's a good way to end the program for today. I cannot thank you enough, Dr. Hyacinth Emele, DMP, specialist family physician from the Department of Health Sciences, FUTO.
Health Services.
Health Services.
Yeah.
Sorry for the mix-up. Thank you again and again and again, Dr. Hyacinth.
Thank you, too, for having me.
All right. We wish you the best going forward. Yes, you've heard andropause is real. It exists, so do not think that it doesn't affect men. Yes, it affects men, just as menopause affects the women. So if you think you have low testosterone, the only thing I can advise you to do, like Dr. Emele has said, is go see a healthcare provider. Professional, don't go to quacks, yes. And then you get all the help that you need. Up next is the news at noon. My name is Mary Omeniwode. You can call me the Slim Diva, your most adorable. Thank you, J-Boy. Back to the music.
With DJ J-Boy. Are you serious?